You are listening to Prevention is the New Cure, all things health and NHS with a political twist.
And that's with me, Dr. Helen Stokes-Lampard, and with Steve Bryan MP.
Hi, Helen.
Hi, Steve.
How you doing?
I'm good, thank you. How are you doing?
Fine, yes. Welcome to episode 23. We've got a very special guest joining us. Some may say political royalty, but more of that in just a moment. So we're back on Zoom today, so I can see you and hear you loud and clear. Last time we were together in Portcullis House, we did our special focus on dentistry and oral health, and we had Sarah Hurley on, who, for those who don't know, used to be the Chief Dental Officer. That episode's still available on our podcast platform, and we've had a lot of feedback from it. We had a good discussion, didn't we?
It was excellent. We covered so much ground with her. We really did romp through a lot of stuff. Contracts, recruitment, retention. And actually, I caught a little bit of PMQs earlier today, because we're recording this on Wednesday afternoon. And I heard that the Prime Minister's committed to a dental development plan. Do you think he got to listen to the podcast last week?
I think he might have. Well, of course, they've been saying for a long time that the dental recovery plan is coming shortly. Well, they said soon, and then they said shortly. And I can tell you, as a minister, that means that it hasn't yet been signed off by Treasury right. when you're told to say shortly, because it covers a multitude of sins. I remember once I was bringing out the child obesity plan, I said in the chamber that it would come out by the summer. To which some wag shouted, "Which summer?" And I didn't really have an answer to that. But the fact is that the dental recovery plan is got quite a lot in it, and it was written by the former dental minister and the former Secretary of State, and it's been tweaked by this one, and it is shortly. But I happen to know, my little birdies tell me that it is very imminent. So soon has gone to shortly, has gone to imminent. So Excellent. By the time this podcast comes out on Thursday morning, the 1st of February, and it won't be pinch punch first of the month, it will be possibly with us, but if not, it's very, very soon.
I do love the hierarchy of waiting, the hierarchy of anticipation.
I know. Only in Whitehall, Helen.
Hey, Steve, last time as we were signing off, you were heading off into a big birthday celebration. Now, I won't remind anybody who doesn't know just how many decades you were celebrating, how big it was. How was it all? And did you like my card?
I loved your card. Thank you very much for that. Yeah, it was, well, I was born in the 70s and it had a 0 on the end. So do the math, as they say, the other side of the pond.
You don't need Mensa for that.
Do you know what? The guys who help us with the podcast, the production team, were just asking I haven't seen them since the weekend, how was birthday? And if you have to have that big birthday, then it was the most perfect way to have it, if I'm honest. Really nice. We spent the weekend by the sea in Hayling Island. Which is where I've never been before. We spent the weekend by the sea in a beautiful townhouse, which reminded me of an episode of Grandpa in My Pocket. So people who watch CBeebies will know what I mean by that. Okay. And it was a 3-story townhouse with the bedroom up the top. And I woke up on my birthday with a view of the sea and the sunshine. And we had various friends and family that we entertained throughout the weekend. And yeah.
And Monty?
And Monty was there, of course. So our great friends, Lee and Lindsay, bought their yellow lab, Molly, who is 2. Monty is a black lab who is 4. He thought it was his birthday and Christmas rolled into one. And he, bless him, he didn't know how to cope with it, Helen. He kept sniffing her, as they do, but he also it was bizarre. He basically followed her around the house and kept nudging her, like with his nose, like nudging her back, or like almost knocking her over. It was like, as I said to him, Monty, you've got a long way to go, boy, in learning how to woo the opposite sex. But eventually she told him off, and then they both knocked over a can of beer.
Excellent. Good.
And then we went for a lovely walk on the beach, and Monty went chasing into the sea to catch Molly, and they both got hit by a massive wave and knocked over.
But they're both okay.
They were both fine. So they had a wonderful time. But thank you for asking. Yeah, it was a great birthday.
Marvelous. Oh, Steve, I'm so glad to hear that. Last time we were recording this in your office in Westminster, but you've been on your travels this week. What have you been up to?
Yeah, I have actually, because although I chair the health committee, and that's my great passion. One of my other great passions, which I don't think we ever talked about, is culture, media, and sport and music stuff. And so
We
I'm
talk
I'm
about music a lot, actually.
Yeah, we do. Yeah, no, I'm still on the Culture, Media and Sports Select Committee as just a regular member, and we've been in Manchester for a couple of days. So one of the things we did was visit British Cycling at the velodrome and the HQ of British Cycling, which is there, and saw some of the secrets as they get ready for the Olympic Games this summer, which was incredible.
Oh, that's
And
exciting.
they were talking about, so later on this week, actually on Friday, there's a big announcement from British Cycling. So they do the elite cycling, but they also do your low level cycling stuff, which is part of the health and well-being walking cycling strategy. And there's going to be people who are interested in cycling will be interested in what they're going to come out with later this week. And I was just struck by obviously the elite cyclists. We watched them go around the velodrome. Oh boy, Helen, you should see the size of their legs. And the Paralympians.
I'd like to have seen that.
But they were saying how on the Monday after that Super Saturday at London 2012, and we won all those medals. Apparently there was apparently there was a real boost that week in GDP because people felt good. And you know what? Absences that Monday after Super Saturday were the lowest that they had been in years because everyone wanted to be in work to talk about what they'd seen on that Saturday.
Wow.
And there was an actual spike in GDP. So isn't that incredible?
That is amazing. I mean, that was just the most remarkable time, the Olympics in London, and really special. And you talk about cycling. I live just outside Birmingham, and the road I live on is actually part of the Heart of England Cycleway. And so we have a huge number of cyclists going past. And it's a sort of country lane, and you see all sorts. I think that's what's really amazing is you see people who are clearly committed, got all the gear and actually do have a lot of idea how to use it and zoom along. But then you see a lot of people who what I call much more casual cyclists, and that's great to see. It's had a huge resurgence.
Yeah, so that was cool. And then we did some stuff with, so grassroots music is very much where I grew up, in music in the back of a pub. Those not the big venues, the grassroots music venues, which is where bands learn their trade. I suppose the Cavern in Liverpool would be a grassroots music venue, and it's where people learn how to be a band, and they're so important. And there's about 850 of them left in the country, and we lost a lot during COVID, and we've lost a lot over the years because it's really, really hard. It's really hard, the economics of running one of those venues. So we had a big round table with them, and one of the things they were talking about is live music and that buzz that you get from going to an event like that, and how that could be connected to social prescribing. And I thought, well, I know somebody who knows a thing or two about that. What do you think?
You're talking my language, Steve. Yeah, I'd love to talk longer about the huge benefits of music on well-being. So there's the social bit about being in a place like that where it's live music and interacting with others, and there's a sort of a collective sense of well-being. There's also all the good. We know that even playing a musical instrument can be great for your health. I mean, we got some awesome research about people with dementia and the benefit of either singing or playing a musical instrument. People who've played instruments before, there's benefits on reducing a progression of dementia. There's benefits on people's well-being when they have even advanced dementia. And one of my heartwarming stories as a GP was seeing a delightful patient of mine who had developed quite an aggressive dementia and had recently moved into a nursing home, and he was just sitting sort of slumped in the corner. And I mentioned to one of the carers that he was a brilliant pianist. In fact, his job had been a pianist and teaching music. And they said, we got an old piano in the other room. It's sort of tucked in a corner. And so they led him and showed him to the piano. Honestly, Steve, he just lit up. He became a new person. And those months that he spent there in that care home, he entertained all the other residents. Honestly, it was just so heartwarming and a really powerful lesson for me as a GP. It was almost a throwaway comment by me, but I've never forgotten it.
That's incredible. Yeah. So anyway, so to conclude on that, we went to a gig on Tuesday evening at a venue, very famous venue, managed called Band on the Wall, and saw a band called Jazz Sabbath. And it's a jazz trio. Jazz trio. Do you remember Jazz Hands?
I do. I certainly do.
I'm just going to leave it there.
Okay.
Anybody's interested, Google Jazz Sabbath. Just before we introduce our guest, we've got 3 royal health stories kicking around at the moment. Now, obviously, Kate has been in hospital, just come out this week, and we rightly don't know what that's about, abdominal surgery, and we just leave that there. Sarah Ferguson has got this apparently awful aggressive skin cancer diagnosis, and the King has been in for an enlarged prostate procedure.
Yeah.
How important is it, do we think, for people like that to talk about their health challenges?
Well, I think there's two sides of looking at this. If you think about Kate, we know that a very prominent member of the royal family has had major surgery, and she's chosen to keep quiet about the causes of it and her recovery. And as a doctor, I 100% respect somebody's right to confidentiality and privacy. It is totally her business. But when somebody in a very prominent public position, not necessarily royalty, but anyone in the public spotlight, shares a significant health story, it has profound impact on the health service and the well-being of others. If it's done well and constructively, as is being done with the King, for example, we see a positive spike in the number of people seeking information about prostate disease, about men's waterworks problems, and that looks to be a very constructive thing. And so we know, like all cancers, if they caught early, can be treated, but actually the vast majority of neurological symptoms in men are benign disease, and there are treatments that can help, whether that's medication or, in the King's case, relatively minor routine surgery. The melanoma one is a totally different kettle of fish, and it's good for the public to be aware, again, reminded of these aggressive cancers. Skin cancers fall into three main categories: a sort of a minor type that tend to only grow locally and that need local treatment, still need to be sorted because they'll continue to grow. An intermediate type, a squamous cell type, that can be really quite destructive. But then melanoma, which can be potentially very aggressive and serious. And it sounds like in Sarah Ferguson's case that it was caught incidentally. And so we all wish her the very, very best. And so I'm sure we'll see a spike in coming weeks of people looking.
And just finally, with the King and the prostate procedure for an enlarged prostate. Now, just to be absolutely crystal clear, as we said at the Select Committee when we had Prostate Cancer UK in recently, this, of course, does not mean that His Royal Highness has got prostate cancer.
Absolutely.
But it means that he's got an enlarged prostate. So
Yes.
how would that have presented, and what would he have had in that procedure?
Well, everything that we've heard so far is that the King has is benign, that's non-cancerous prostate disease. But interestingly, prostate cancer and benign disease present in very similar ways, and that is with outflow problems. That is where the passage of urine from the body is obstructed by this prostate growing and pressing on the route out, which means that men often notice they need to get up to go to the toilet in the night more. They notice that their stream isn't as powerful as it used to be. They notice that it takes them longer to empty their bladder, urine dribbles quite a lot at the end. In some cases, they notice blood in their urine, they notice sexual problems and so on. But the common ones that usually bring men through the door of the consulting room first are a change in their urinary stream, the change in their pattern and frequency of passing urine.
Yeah. Okay. Well, we wish them, all three of them, all the best, of course. Let's take a break and then we'll introduce our guest. Welcome back. Okay. A few months ago, we had Chancellor Exchequer on, and today we are absolutely delighted to have the new, we still call it new, I think, the new Secretary of State for Health and Social Care, who is my dear colleague, Victoria Atkins MP. She was appointed Secretary of State back in November. Believe it or not. My goodness, how time flies. Previously worked at the Treasury, obviously been at the Home Office, been an MP since 2015, very valued colleague, good friend. Really pleased to have you. Welcome to the podcast, Victoria.
Well, Steve, thank you. I'm blushing from that description, but thank you. It's a real pleasure to be joining you both, because I know how much it is enjoyed by people who are interested in health and prevention, as well as clinicians and lots of other people. So delighted to be with you.
Well, let me add my welcome to Secretary of State. Really great to meet you, and I hope you have some fun. We've got loads of questions lined up. It's bizarre how many people are interested to pitch questions to the Secretary of State when it comes to, we have rationed them to focusing the questions on matters related to disease prevention. There were a whole wide range of things that they came up with. So should we get started, Steve?
Yeah, so there's loads of things going on. Your department is hyperactive at the moment. And as we record this today, Pharmacy First has been launched, been super powered. And so I thought we might start with that, because that's going to be a real interesting move the dial on primary care, we hope. What's it all about? Is it as big a deal as we all hope it's going to be?
This is an enormous change change in not just our mindset as members of the public accessing healthcare in England, but also I think for the medical profession. You know, we know that pharmacists are highly trained, highly qualified people, and we believe that by encouraging people with the 7 most basic or common conditions, if we can encourage people to go to their pharmacy first, then pharmacists will be able to look after them safely. Of course, if pharmacists think that GPs or indeed urgent attention is needed, of course they will make those urgent inquiries. Sorry, that's my email going off. But it's a really, really safe system. And what's so pleasing is that today, 31st of January, we've had more than 95% of pharmacists sign up to this. And I can give you a bit of an exclusive here on the podcast that Boots told me that they had their first customer through the doors using Pharmacy First at 8:31 this morning. So I believe it's going to be huge. Yeah.
It wasn't me. I just want to make that clear. It wasn't me. But so there are 7 conditions, right, yes, that we're extending their work to. And what are those 7 conditions, and what is the new powers, if you like, that they've got in prescribing and ability to then obviously get it into the patient notes from a patient safety point of view? That's, and for Helen's GP gang, that's critical, isn't it?
Absolutely critical. So the conditions are earache, sinusitis, sore throat, impetigo, an infected insect bite, shingles, and uncomplicated urinary tract infections in women. It's really careful. It's really important that we're careful with that last one, because it, as Helen knows far better than me, it can be more complicated in men. But if it's an uncomplicated UTI in women, then they can go to the pharmacist. And without wishing to blow my own trumpet, I've just remembered all of those. So I'm very proud.
I'm quite impressed, actually. You rattled that off really well. And I was actually quite relieved with the urinary tract infection to see that distinction, whereas the others are much more generic, you know, anyone with earache. But it's also adult women as well. It's including children too. And I think that's important too. From a GP point of view, Steve's already alluded to the issues about getting the documentation directly into the primary care healthcare record. I think that's a great hurdle if we've got over that. Actually, as a jobbing GP, we've had quite a lot of pilots of this sort of thing in our area over the last few years, and the pilots are great, and the patients respond to it very well, because at the end of the day, patients want convenience, and most of them love our local pharmacies, and it's a great collaboration. I do wonder if we're being a bit ambitious as to the amount of work it'll save in general practice, but quite frankly, at the moment, from my point of view, every little helps, to coin a supermarket phrase.
Well, the modelling I've been shown by officials working with NHSE is that they think this could free up to 10 million GP appointments, which would be a huge bonus for GPs and practices, but also, of course, for people who need treatment. And we shouldn't forget as well that this is in addition to the 2 services that launched in December, namely blood pressure checks and women being able to obtain oral contraception. So those 2 services have been running since December, and now we're able to launch this further package of help through pharmacies. And on the tech point, you're absolutely right, Helen. We've, again, very much listened both to pharmacists and to clinicians on this, and the sharing of data has been a critical part of our delivery plan. And we believe with 1 or 2 exceptions, which is good, they're going to be overcome, we hope, in weeks to come. But the overwhelming majority of pharmacists will be able to share that data very easily with their GP colleagues.
Fantastic.
So on the prevention point then, which is obviously what we're mostly interested in, I remember when I was doing the public health job and the pharmacy job, we did the trials on hypertension, so high blood pressure, in the northeast of England, and that sort of what became Pharmacy First, and you've expanded it out brilliantly. And you know, this Prime Minister, what credit he deserves, right? He grew up above the pharmacy, and he wanted this, didn't he? He wanted this so much. And I have a funny feeling, although you wouldn't tell us when he appointed you, I bet he said, I want Pharmacy First to happen. But so, I mean, what do we reckon on prevention of ill health, how important it's going to be to pick up all these potential people with high blood pressure and all the illness that can lead to?
It's going to be a huge bonus, and you know, my vision for our NHS and social care system is to reform the system to make it faster, simpler, and fairer. And I have to say, Pharmacy First ticks every single one of those points. But it's also importantly about ensuring that people are seen as quickly as possible, so that if, you know, God forbid, there is an underlying condition or something that needs more investigation and more treatment, then, you know, we're getting them through that process much more quickly. And also, you know, this is on top of the great work that's being done across England now in community diagnostic centres. We are running ahead of schedule. We've got 141, possibly 142, 141 CDCs opening up. And again, I hope both patients and clinicians see the difference that those CDCs make in terms of diagnosing, you know, very often very serious conditions, but doing that more quickly so that patients can get the treatment they need more promptly.
I'm going to move us on now, because much as I'd love to keep talking about this topic, which is close to my heart, I'm going to move us on to another topic that Steve and I have talked a lot about on the podcast, which is about smoking, about vaping, the place of vaping in society, and the big announcement this week about getting rid of disposable vapes. What's been the reaction to that? Because mostly I'm hearing positive, but there are a few caveats.
Well, this has been an incredible week in terms of healthcare, because we've had the announcement on Pharmacy First. We've also had the announcement on the NHS app, which we may be, I don't know whether we'll get time, I hope we do, to talk about that, but also tobacco and vaping. So the Prime Minister set out his ambition to create the first smoke-free generation by 2027. We had the consultation just over the Christmas period, and we've just this week launched our response to that consultation. And what we will see is that every young person aged 15 and younger today will now no longer be able ever to buy cigarettes legally in a shop. That is a huge intervention. I mean, probably the biggest public health intervention we can think of, because as Helen and other clinicians know, it is the single largest entirely preventable cause of, you know, disability, ill health, and dare we say it, death. And so this is a huge step forward. And I know that there will be colleagues or people that are worried about civil liberties and things like that. But actually, if we look back over history, if we look at, you know, the decision that was made to ban smoking in public places or to ban smoking by adults in a car with children, you know, I don't think we would, go back on those decisions today. So I think this is a huge step forward, and it really shows an ambitious plan for our health in the future. But also, of course, it means it will have a huge impact for the NHS. So just whilst we've been on these last few minutes, we know that every single minute, well, pretty much every single minute of every day, someone in England is admitted to hospital with a smoking related condition. And so when you hear statistics like that, you know, it causes 1 in 4 cancer deaths, horrendous statistics like that in fact mean, you know, when you're translating that to your loved one, to your partner, your mum, your dad, your brother, your sister, whoever it is, that has a huge impact on people's lives. And so we genuinely think this is going to be a huge public health initiative. But importantly, as well as part of that, the vaping, I think, I know Helen asked me about vaping, forgive me, I'm so passionate about this, but the vaping is also a really important part of that, because we fully acknowledge that vaping can be really important for adults who are wanting to quit. For some, it is, you know, the way that they make that transition. But we should never, people should not be vaping unless it is because they want to quit smoking. So Absolutely. Children and young people should not be vaping. There's no question about that.
So can I just unburden a worry? You know how I worry. Can I just unburden? I am a worrier, Victoria. I can't, okay. But one of my worries is that, there is some evidence that the numbers stopping smoking are continuing to go down, but that's slowed, partly because we don't talk enough about the danger of smoking, because we've sort of flipped to talking a lot about the problems with vaping. And there's also a lot of evidence. I mean, ASH, the Action on Smoking and Health, will say that adults coming off cigarettes, like the disposable vapes because they're cheap. They actually like flavors because they find the non-flavors boring. And I just wondered what safeguard is there in there to make sure that adults who need that and who talk to GPs like Helen about using that to get off the ciggies have still got that option in the toolbox?
Well, as part of this overall package, we have also announced a doubling of the funding for smoking cessation services. So we're taking it up to £138 million. It's great news. And that includes the Swap to Stop scheme, which I have checked, don't worry, it doesn't use disposable vapes, it uses reusable vapes in line with our overall policy intention. But so we want to encourage adults to use vapes in order to quit if that is the right approach for them. And Helen will know, as I say, far better than me, that there will be different approaches for different people. But we are also going to be running some pretty strong comms this year, public campaigns to help people feel supported as part of their efforts to stop smoking. Because look, nicotine is amongst the most addictive substances that we can think of. And when I talk to friends and others who started smoking as a young person, I've never met a smoker yet who doesn't wish they hadn't started.
Absolutely.
And so if we can, the reason that we're targeting disposable vapes, and we're also looking at the flavors and the colors and the packaging and the location of the shops, is because we know that the rates of children and young people using vapes has tripled in the last 3 years. And we know that some of these flavors and packaging and so on are very cynically marketed at that younger market. And so we want to absolutely crack down on that and to ensure that children and young people grow up knowing that they should not be vaping, because it is not, it's not a lifestyle choice that is going to help them in years to come. It should only ever be used to stop smoking.
Right. So obviously the vaping stuff you talked about this week, and Parliament is going to respond to that. I think there's some regulation work that we need to do in Parliament, and then the smoking and vaping bill itself, which is about the age and making sure that nobody who's 14 at that point will ever be able to legally buy cigarettes. When do you think that is going to get before Parliament?
I'm going to give one of those answers that ministers give, I'm afraid, which is shortly.
Okay.
So I once described that. What does shortly mean? In civil service time, it's more promptly than in due course, but not as promptly as
well, look, it's funny you should say that, because we were talking before you came on at the top of the show about how I used to say this as a minister, shortly becomes soon becomes shortly, and shortly becomes imminently. And would it be fair to so that could be shortly?
Moving on, Steve.
Would it be fair to say that the dental recovery plan, which I know you care passionately about, is that a soon, a shortly, or an imminently?
Just to reassure people on the sorry, this is very Politico and Westminster, but the just on the smoking bill, I want to get it out. I believe you me, I feel great urgency, and I am by definition an impatient minister, so I will get it out as soon as I possibly can. And there's a huge support across government, but also we know how much mums and dads and carers and others want to get this legislation through as quickly as possible to protect their children and so on. So we get the urgency. It will be, as I say, it really will be shortly. But in terms of dentistry, I'm an impatient minister on that, and we are working out what I hope will be a really exciting package for people to access NHS dentistry. One of the reasons being, and it shows the value actually of our parliamentary system and the importance of ministers and their having their constituency experiences. I am very much bringing my experiences as a constituency MP in rural and coastal Lincolnshire into the thinking on this, because we know that there are some parts of the country that have great NHS dentistry provision. In London, there's generally quite a bit of choice, but in rural and coastal parts of the country, it can be really difficult. And so we're trying to address those needs as well.
Okay, couple of quick ones. Jacqueline Gordon on Twitter. We know clean air would reduce premature deaths and disease in the country by approximately 40,000. This is her figures. If this was a disease, there'll be an outcry. Well, of course, it can lead to disease. Why is it not a health priority to reduce air pollution of all kinds? Where does air pollution stand in your inpatient priority list?
Well, as you'll appreciate, this is it's a cross-government piece of work, because although sadly the health service will have to deal with or look after people who are suffering from the ill effects of clean air, of course other parts of government, including DEFRA, hold the levers on this. And so we monitor it very carefully. DEFRA monitors it, and we make sure that it's reviewed carefully. But we very much want to set commitments or targets, that are achievable. And I think as we as a society, as we see this move towards, for example, electric vehicles, the very, very exciting and far-reaching work that is going on even with aviation fuel, we will begin to see real step changes in the quality of air. But I absolutely understand why people are concerned about this, and as I say, it's a piece of work across government that really trying to address this.
A lot of stuff at the moment about physicians associates. We had a lot of people contact us about that. People concerned about it. It seems to be an issue that's sort of going up the political agenda. Can you set people's worry, people who worry like me, about physician associates and their role within the workforce?
Yeah, very much so. So first and foremost, we have really wanted to ensure that we have when we look at the needs of the NHS over its future, I describe what we call the long-term workforce plan. To me, that was launched in the 75th year of the NHS, and to me, the long-term workforce plan is how we build for the next 75 years of the NHS. So this is about how we best use people within our workforce, how we look at having different roles within the NHS, because I think we all appreciate it's changed over the last 75 years, and so we should be flexible and reflect that. And physician associates are just one of the ways that we're trying to both broaden access to medical occupations for people who want to do that, but also to help boost patient safety and access to healthcare. So physician associates, look, I understand, I know this is new, and I know that people are rightly looking at it, scrutinizing it, and are concerned about it. I get that. It's why I was so clear and firm that we will be regulating these. Of course we will. And we are very clear also that they will never replace doctors. They are there to help doctors a little bit. I don't know if it's an appropriate analogy, but a little bit like a teaching assistant helps a teacher. Physician associates are there to just help ensure that when, let's say, a very busy doctor in a hospital, they're trying to get through their list. Let's try and use the physician associate to help that doctor with the sorts of tasks they need to perform outside the appointment itself, so that the doctor can spend as much of their time as possible focusing on the patient. So there's a lot around this, and I genuinely, I'm very much listening to concerns, but I do.
And I would say that it's become a lot of heat in this topic recently, and actually we've had them in the UK for 20 years. We've learned a lot from the States. There's great research about them, how to educate them, how to train them, how to work with them. I've worked with them and had fantastic experiences. So there's a lot of misinformation out there too. So I think the professions have a role in sort of spreading the good stuff as well as working with you to get the regulations sorted. But I'm going to move us on. I'm conscious of your time, and we've got lots of questions. Can I throw a couple of quick ones at you? Would that be all right?
Yeah, sure.
So I've got one here from the Chief Executive of the National Academy of Social Prescribing. Conflict of interest. I'm related to the National Academy of Social Prescribing. So Charlotte Osborne-Ford via LinkedIn asked us, will the government accept the recent recommendations from the Health and Social Care Committee on prevention for the need for a national strategy for social prescribing? Thanks for this one, Steve. Thanks to your committee.
Well, look, I think social prescribing can be really important and of real value to people. So we very much understand why the committee recommended as it did. We want to go further, and I think we are looking very carefully at how we can build on what we have already achieved. So I think there's something like 2.3 million referrals have been made to social prescribing services. I mean, it's another great example, Helen, actually, of ensuring that we're using you as GPs in those cases where we really need your expertise. And if there are other ways in which we can help people, it will not always be through a GP. And so we very much are excited by these. But the NHS, I think, has recruited nearly 3,500 social prescribing link workers. So I think there's much more to be done with this. I think it's a really exciting area.
It is. I love my link workers in the practice. They do what I always used to try and do, but they just do it so much better than I ever could. So yeah, loving the link workers. Yeah. Going to move us on. We had a question about sugar in foods. This one was off the social media platform formerly known as Twitter, from Pawan Randev. How do you and your colleagues at DHSC propose to reduce sugar and carbs content and ultra-processed foods to help manage the diabetes and weight disaster, I quote? And I guess this is about strategies, obesity strategies.
Well, of course, sugar has already been dramatically reduced in children's foods. And indeed, because to tackle the issue of diabetes and obesity and so on, we have to look at all of the factors at play here. And of course, quality of sport, of physical education, of participation in physical activity for all children is critical to that. So we're very much supporting work on that. We are also delivering schemes such as Healthy Start that encourage healthy diets. And we are also investing in mental health services, and appreciate this won't apply to everyone, but it is a factor that we are very keen on ensuring isn't missed for those people for whom it's relevant and appropriate. We want to try and ensure that we're supporting people across the board with healthy eating and exercise, because actually, what we try to do now for young people and children, rather like with tobacco and vaping, that will hold them in good stead for many, many decades to come. And we're all living longer, healthy, longer lives. We want them to be long and healthy lives. And so that's the big challenge, I think, for healthcare systems actually around the world, is how we make sure that we live longer, but we live healthier as well.
Victoria, that's brilliant. And it's so interesting to hear you mention diabetes there in that question, Helen, because obviously, Victoria, you live with type 1 diabetes, don't you? And you have for many years.
So I was diagnosed with type 1 at the age of 3, and the NHS is genuinely one of the reasons I came into politics. And so it's an enormous privilege to be made so.
Bless you. And I've got on my desk a report from George Howarth and your former boss at the Home Office, Theresa May, who have a funny feeling might be beating your door down to talk about type 1 diabetes and disordered eating parliamentary inquiry. Listen, it's great to have you with us. I think the division bell is going in the House of Commons, so we all need to go and vote just to prove that this is live.
Take care.
Thank you so much, and good luck with your role. Bye.
Bye.
Welcome back. Well, that was a great conversation. We covered a lot there, but I know, Steve, there must have been a dozen more questions we didn't touch on. So huge apologies to anybody who has submitted a question that we didn't get to. We'll see if we can follow up with the Secretary of State.
Yeah, look, I mean, at the end of the day, I said to you before, the clerks and select committees say that I'm exhausting. Victoria is exhausting as well. And I love that. I love that about her. I love the fact that she is so full of energy. And, hey, look, she's got limited time until the election to do all the things she wants to do. So why not? Why not be ambitious, and why not be energetic and impatient? That's exactly how it should be. But we covered a lot of ground, and interesting. Yeah, I think she shares our passion for prevention. So anyone who brings forward that sort of smoking legislation clearly does.
Yeah, well, bring it on. Bring it on. Steve, we're running short of time, but I don't think we can finish up today without mentioning measles. Now, for those of you who are not aware, I'm a GP in the Midlands, and the Midlands is the sort of the epicenter. It's the measles nexus of the UK at the moment. We've got a lot of cases. Have you been hearing much noise about it in Parliament?
Oh, very much so. So we did a big vaccination report, which was the first work stream of our prevention inquiry. Last summer it came out, and we heard evidence from Jenny Harries, the UK Health Security Agency, and others. And we did warn in that report that we reported warnings that there was a measles problem coming down the track. It is in certain communities, and it is certain, and therefore, and it is certain areas. But it's a problem, and we need to do everything we can to get the message out there, particularly for that generation that missed out on MMR, to get yourself vaccinated, but also, get the kids vaccinated. It's the best thing that you can do, and it's perfectly safe, right, Doctor?
Totally safe, totally. And there's a big new campaign going out at the moment. We're setting up extra clinics in our surgeries. We're going to be contacting everybody who, from our records, hasn't had their vaccination and is eligible to do so, starting with the youngsters first and then going on to people up to the age of 25 in the West Midlands region, although it'll mostly be focused on younger children in other parts of the country. The key things are measles is ridiculously infectious. It can take up to 3 weeks for you to develop symptoms having become infected. So it's got this really long period of time in which you're infecting others. And so, epidemics can spread really quickly. So if you're called for a booster or your kids are called for a booster, please, 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 please take them, and encourage everyone you know to be checking and responding to.
You're right. 75% of England's cases are in the West Midlands.
Yeah.
It is quite localized at the moment, and let's keep it that way. I mean, in your career as a GP, I mean, how many cases of measles have you actually seen? Presumably very small.
Very, very full. I mean, probably less than half a dozen. I remember a couple of cases because we notify them now because they are rare. I remember the first one, not knowing what the heck I was seeing, and then suddenly having a moment of, oh my gosh, could this be measles? Because I'd never seen a case. And I've been a GP for quite a long time, more than 2 decades. That's all you need to know on that. But this is a big shift, and it's a disappointing shift for a completely preventable disease. Anyway, I think we need to wrap it up, Steve.
I think we do. So we will be back in usually we would be back a fortnight. We'll be back in 3 weeks because it's half term, and I'm going to take the kids away for a little bit of a break while Parliament's on recess, while they still want to go on a holiday with me. And so we'll be after that. We'll be back with some more, and we've got some very interesting guests lined up.
We certainly have, and there's lots of stuff we could have talked about this week about health stories that we're going to bank for another time.
Yeah, back for another time. See you soon.
Take care. Bye.
Bye.